Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Senior Marketing Specialist Rachel Rom. In today's episode, we sit down with CompleteRx Area Clinical Manager Jennifer Siegel to discuss Me Too drugs and the impacts they can have on a hospital or health system's bottom line. Okay, so welcome, Jennifer. Thanks for joining us in today's episode.
My pleasure to be here.
So today we're discussing Me Too drugs and the impacts, both good and bad, that they can have on hospitals and health systems. So I wanted to first ask you if you could offer us a little detail on what exactly a Me Too drug is.
Absolutely. So a Me Too drug, there are basically two types. One is it's exactly the same drug that's been reformulated. So examples of that might be bupivacaine or naloxone. It's either offered in a different formulation, it's offered in a different strength, but it really is exactly the same drug that's already been on the market previously. The second type of Me Too drugs is something that maybe acts very similarly. So when we think of NSAIDs, we think of Advil and naproxen, right?
Mm-hmm.
Those are two basic. They really are different drugs, they're different chemicals, but they act very similarly. So we wouldn't necessarily need to have both, where
Right.
one would be very effective.
Okay. So it sounds like on the surface, there's not very many differences, but let's talk about the impacts to a hospital or health system if Me Too drugs are added to the inventory. I can imagine that there would be some waste or carrying costs. What would you say there are?
Absolutely. So let's look at this from both sides. When we can improve patient care, when we can have safer agents on the shelf, they work better, they're more efficacious. Perhaps we can even replace an agent that we currently have. They may even be more cost effective for a hospital system. On
Hmm.
the flip side, we have to think about how much shelf and storage space is this going to take in the
Right.
inventory waste. If we have to carry two products that are very similar, one of those may expire out before we get to use it.
Hmm.
Med errors are a huge problem, and we see that these drugs that have very similar names or they look very similar can lead to patient medication errors and even adverse events. There's also the cost and the time of educating providers and clinicians about the new drugs. This has to go through committee approval. We need resources to add it to the CPOE system, and we have to make sure the billing is appropriate. So there's a lot of resources and people that need to get involved in adding a new product to their formulary.
Yeah. So, I mean, and it seems like to me that it's very easy for these drugs to make their ways into the hospitals or health systems. So, if there isn't some sort of process, there's no way to vet whether or not there will be a positive impact or a negative impact. So, can we talk about what it is that we do to ensure that our partners are choosing the appropriate agents to carry?
Well, we are a resource they can tap into. What we do differently is we have templates built and processes set in place so that we can very quickly and effectively assess these Me Too agents to determine whether they'll be beneficial for the hospital. Will they be safer, more efficacious, cost effective, reduce waste, keep the patient safer? We go through that process, but it's a very strict process that we do here. We look at reimbursement even on our end to make sure that the hospital will get appropriate reimbursement for these agents. So I believe that's what we do differently is we just have such a great process for assessing these agents.
Right. And I think that's something that's often overlooked. Just from a hospital executive's perspective, there's probably a little bit of an assumption that there is a process in place, but with so many individuals being able to bring in new drugs, if it's not reviewed or assessed kind of from the pharmacy's perspective, or controlled for a lack of a better word, then it can kind of the results can become costly. So I'm glad you've been able to shed some light on this really important topic. So thanks again for your time today.
Oh, I'm happy to help. Thank you.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.